So, hi, I'm Sharon Mayer. I'm the certified functional nutritionist at the Institute for Health and Healing. And the Institute for Health and Healing is the integrative program for Sutter. So, good morning, good afternoon, actually. So today we're going to talk about cholesterol. I know we were supposed to do it last week, but things happened. So today it is about cholesterol. So it's really interesting around cholesterol. It's interesting because people still have so much fear around cholesterol, and it's still being blamed for heart disease, even though we now know that inflammation is really the link. It is the part that is more problematic than the whole thing around cholesterol. So we're going to talk a little bit about that. So let's understand what cholesterol is. Cholesterol is a vital substance. We need it in order to be alive. The liver makes 75% of our cholesterol. And what really happens with this is that the liver gets triggered to produce fats and cholesterol in response, folks, to sugar and carbohydrates. This is called lipogenesis. 25% of cholesterol is absorbed from our diet. So a small amount, really, if you think about it, 25%, whereas we make 75% in the liver. 25% of cholesterol is in the brain, and it's needed for brain function. It's needed for building blocks, for neuronal tissue. We need it in order for the brain to function. So if we cut and push down cholesterol too low, we start to see the function or the dysfunction of brain function. It also acts as a transport molecule to shuttle fat-soluble nutrients into cells. So if you think about vitamins A, D, E, and K, it's got to be transported into the cells, and it's done through these transport molecules. We'll talk a little bit more about it. Cholesterol also serves as an essential building block for making our stress hormones. Think about cortisol. I'm going to talk a little bit about an example of stress and cholesterol a little later. But we also need it for our sex hormones, progesterone, all the estrogens, the 3 estrogens, testosterone. We need it in order for us to be able to build those and make those hormones. It's also required for vitamin D, and it helps with thyroid function. So you can see it plays such a major role in so many different functions of the body. So traditionally, we have thought that elevated cholesterol causes atherosclerosis. Now, atherosclerosis, is the formation of plaque, and that can ultimately lead to heart attack or stroke. So this came about as cholesterol is a component of plaque. So we thought about this being the big issue, is cholesterol the link with atherosclerosis? But it is a component of plaque. So plaque is sort of the obstruction that can be very dangerous, and that's the link with cardiovascular. What we now know is that the plaque formation is more than just the buildup of cholesterol. It's a result of prolonged inflammation at the site where plaque forms along with an interaction between calcium and cholesterol and other substances. So plaque is a combination of different molecules, including cholesterol, but it's not just cholesterol on its own. Actually, if you think about this, the body uses cholesterol as a kind of internal bandage when chronic inflammation damages the arterial lining. So again, even from a cardiovascular point of view, it's a necessary substance in the body. So let's understand a little bit about the terminology. We know about LDLs. LDLs are considered to be bad. Everyone talks about having too many of the low-density lipoprotein, which is what LDLs means. HDL is the high-density lipoprotein, and that is considered to be really good. And so there's always this tug-of-war between the good and the bad. But in reality, LDL and HDL are not cholesterol, but the transport vehicle for cholesterol. So they're molecules that get packed with cholesterol molecules inside them. So let's understand a little bit more about LDL. So LDL's primary role is to transport fat-soluble nutrients into cell membranes. The LDL particles are categorized based on sizes. So there are two specific sizes when we start to look at LDL molecules. There is pattern A, and these are the largest and tend to carry more fat-soluble nutrients, but they also carry antioxidants. And these antioxidants protect the body from oxidative stress and damage and inflammation. So we can therefore say that they are definitely more cardioprotective. So when we're thinking about pattern A LDLs, we're thinking about these large, fluffy particles. Think about beach balls that are pretty much bouncing around in your vasculature within the vessels of your cardiovascular system. So they're bouncing around, not doing much damage. Then we think about pattern B. So these are small enough. These are tiny little particles, kind of pellet sized, and they're small enough to enter the endothelial lining of the arteries. And when they get in there, they can become oxidized. So when we talk about oxidation, it's more about rusting. The function of oxidation can be very pro-inflammatory. And they are more likely to form plaque. So we're thinking about these small particles, and we're thinking about the beach ball, fluffy, large types of particle A. They're important, or pattern A. And there's a really direct correlation between high quantities of these small, dense particles and cardiovascular disease. So to recap on this, particle size plays a huge role in cardiovascular disease. We're thinking beach ball, we're thinking pellet-like particle sizes. So they're important. And that's where we want to be looking at. And that's what we want to be looking at when we're testing. So HDL, considered to be the good cholesterol, its primary role is to sweep up the LDL particles and return them to the liver for recycling. So we want to see a balance between HDLs and LDLs. Okay, good so far? The next thing we look at is triglycerides, right? So triglycerides are a significant energy source for cells. The LDL particles transport triglycerides to the cell membranes, and there they are metabolized to make energy. So when I see high levels of triglycerides on anybody's labs, I'm thinking, what's going on in the body? What's the risk factor? What's the issue here? And I'm always thinking about insulin resistance. And we know with insulin resistance, this is the risk factor for all diseases, including autoimmune disease, cardiovascular disease, obesity, cancer, and more. About what is going on with that. And what is the link with insulin resistance? A lot of times too much sugar, too many high carbohydrates. So if I see high triglycerides on labs, I'm definitely looking at the diet and reviewing what's going on with glucose and carbohydrates. There are other things that we really need to be looking at if we're thinking about heart health, cardiovascular health. So besides looking at LDLs, HDLs, and triglycerides, we probably want to look at lipoprotein A, also known as LP little a. And this is a genetic marker. And a lot of times docs and cardiologists are looking at LPA. But it's important because it looks at that genetic particle of how you're managing your cardiovascular system. So, and a lot of times there's conversation about this not being changed, depending, it doesn't matter really what you do. If you change your diet or you take specific supplements, the number doesn't change. But I've actually seen it change with specific supplements. So that is a conversation that I would have with each patient. The other thing would be looking at homocysteine. So homocysteine, if it's very elevated, would be an indication of inflammation. These are not what we see on standard labs either. And I also like to see the omega-6 to omega-3. So omega-6 can be very pro-inflammatory, and omega-3s is looking at anti-inflammatory, reducing inflammation by using some of those fish oils, etc. It's a balance between the two of them. And then there are some other factors that are interesting to look at. ApoE4. This is a genetic predisposition or genetics. And if anybody has an ApoE3, an ApoE4, it could be from both parents or it could be just from one parent. And there is conversation about how they recycle or don't recycle fats very well. So for some of us, then that gets to be problematic. But again, it comes back to how is your body functioning with all of these different factors? You know, labs are great, but how are you functioning with these? So besides looking at the cardiovascular and your cholesterol numbers, we also need to look at other parts of the body. So remember, everything is connected. The heart, the brain, liver, hormones, everything that we do is functional in the body. And many things can impact how cholesterol is handled, or those lipoproteins are traveling through the body. So we want to be looking at inflammation. Inflammation is part of our immune system. If there's high amounts of inflammation, we can find it happening in different parts of the body. It could be joint pain. It could be arterial atherosclerosis. It could be many different functions. So it's about how do we reduce that inflammation. So we need to be looking at food sensitivities. Am I eating the foods that I don't tolerate well? Do I have an allergic reaction to those foods? Am I sensitive to some of those foods? Because that can promote inflammation in the body. How's my gut functioning? You know, do I have enough fiber to help clear excess cholesterol? Constipation can be very problematic for people that have a propensity for increased pattern B LDLs. The microbiome, you know, some gut bacteria can impact cholesterol balance. And think about the Goldilocks syndrome. We don't want too much of that. We don't want too little of that. Just enough of that would be very good. But some of the gut bacteria, if they're extremely prominent, will impact how we absorb cholesterol. We might be absorbing too much from the diet. Liver function, things like environmental toxins, pesticides, non-alcohol fatty liver disease can impact how we balance those cholesterol numbers too. Thyroid function for sure. And let's not forget about stress. Here's an interesting story. In one of the functional medicine labs up in Gig Harbor, a woman had just gone in and had a whole battery of tests done for cardiovascular health and cholesterol, etc. And she came back in, got into her car, and instead of putting her car into drive, she put it into reverse and reversed into the back of a building and scrunched up her car. And they took her in immediately. She was fine, and drew her labs just to see what the numbers looked like. What was fascinating was that all her numbers had increased because stress had had increased her numbers. So even stress will increase your cholesterol numbers too. Cholesterol is like the mother hormone, and we make our sex hormones and our stress hormones from cholesterol. It's one of those functions. So what we do know is that high carb sugar diets increases the production of triglycerides. It lowers the HDL and increases the number of the LDL particles. These foods also reduce the size of the particles, increasing the small pattern B. Remember, it's not that LDL is bad, but it's the particle size. And as we've discussed before, sugar and not cholesterol is a villain. So fats are not even so much of a villain as the sugar is. So we want to be reducing the sugar then too. There are many diets that work, and there are many diets that don't. I have patients that have come to see me on vegan diets. and we've seen their cholesterol numbers be really high. Well, we have to take in the whole milieu of what the body is encountering: stress, detoxification, gut function, etc. I've seen people on keto diets that have had high numbers of different types of cholesterol. So when we're thinking about testing, there are a couple of labs that are good. IQ cardio can be done by your general practitioner, IQ cardio, and that gives us a lot more information. Specialty labs are done through Boston Heart Labs and Cleveland Heart Labs. They look at lots of different markers, and that's done through specialty practitioners. So our functional medicine docs would be doing, and in our clinic, we do the Boston Heart Lab. It gives us lots of great information. So, any questions? You may want to unmute yourself and ask any questions, or you can just send something in the chat, in the chat box. Well, folks, if there aren't any questions, that will be all for today. All right. I'll give you another minute or two if you've got something you need to ask. Excuse me, I'm losing my voice.
Looks like there's a question. What are some of the physical symptoms someone would notice with high cholesterol?
So that would be, a lot of times you're not going to feel any of the functions of, or the symptoms of high cholesterol. You really need to be having a look at it through labs. I've not known anyone to have any feeling like they are impacted by high cholesterol. Any other question? So the other question was, are there any studies correlating the use of statins with low testosterone? Not that I know of, but it makes sense to me if we're thinking about high cholesterol. It's, as I say, it's one of the mother hormones for making stress and sex hormones. So if you're very stressed, you're going to be drawing from that to make those stress hormones, particularly cortisol. And are there certain foods that lower LDLs? Remember, we don't want to lower too much of the beach ball fluffy types, but certainly foods like high sugar and high carbohydrates is going to make a change with that. So no cookies, no cakes, that kind of thing. So about diets for cardiovascular disease, the most studied diet is going to be the Mediterranean diet. But you know, the Mediterranean diet covers many different aspects. I'll be talking about diets in the next week or so, and we'll get into some details about that. If you are on a statin, you should definitely be taking some CoQ10. Coenzyme Q10, because statins deplete our bodies of CoQ10, and we need that in order to be able to make energy. Also, CoQ10 works as a major antioxidant. Okay, folks. Thanks for joining us. Take good care.